Welcome to the ThinkData Podcast in partnership with Dataworks. And today I'm really excited to be joined by Dr. Rishi Kerkar. He is the Chief Medical Officer of Counsel Health. They are a super interesting physician-led platform that uses AI and messaging to deliver fast, accessible care. We're going to talk a lot and go into a lot of detail. Rishi's background is very unique. And obviously he's found himself in a super hyper-growth startup. We're going to cover their vision for AI-powered care, how AI is really expanding capacity, training AI like medical students, and some of the key lessons him and his team have learned from building an AI-first practice. Rishi, good to have you on. I know we finally made it happen, so thanks for coming on. And you obviously spent a number of years. This actually, for me, is actually a first speaking to someone who has come from the background that you have, obviously practicing medical officer. You've come in from Mount Sinai. You've joined, obviously, an AI startup. So I'm really keen to touch on your background. Obviously, a quick summary of that would be great. And then who Counsel are, and for the listeners here, what problem are they looking to solve?
Yeah. First of all, Alex, thanks for having me. Awesome to be on the
Pleasure.
pod. Yeah. And happy to talk a bit about my background. So I'm an emergency physician by training. Trained out here in New York City, where I'm calling in from in the Mount Sinai system. Emergency medicine is an interesting profession that was sort of invented in the United States, actually, with the rise of ambulances and the interstate highways back in the 50s and 60s. And it came about because there wasn't a dedicated specialty that could handle sort of acute care situations all in one place. Now that specialty spread sort of all over the world. But for a long time, the ER docs were kind of moonlighting internal medicine docs, family physicians, sort of anybody that can staff the emergency room. Eventually, what kind of the early pioneers of emergency medicine decided was we needed a dedicated specialty that handled that first touch when especially really sick patients came to the hospital. And emergency departments used to be just called emergency rooms. Like it was literally like a room that was connected to the hospital, and they were running these emergencies out of them when people had cardiac arrests or heart attacks or strokes. And eventually the goal is to get that patient to the type of care that they eventually need. In this case, it was emergency care. They needed their heart attack taken care of. They needed to go to the ICU. They needed a ventilator, whatever it may be. And we found that it was much, much better to have physicians that were dedicated to that first stabilization point of an emergency, because we can learn, everything that a patient needed first across a number of specialties. What is the first 1, 2, 3 things that need to happen if a patient has a stroke? What are the first 1, 2, 3 things that need to happen when a patient encounters trauma, rather than have sort of other physicians that are kind of moonlighting in those spaces? It took a number of decades for the profession of emergency medicine to sort of fight for its right to sit at the table of the greater house of medicine. But now it's a very established specialty, and it's been actually expanded globally. So developing countries have their own training programs, and it's become quite sort of accepted and established that emergency medicine is its own sort of career. That's the kind of
Interesting.
lens that I came from. So I trained in emergency medicine, and I also feel like all physicians have this sort of the one almost traumatic event that sort of defines the rest of their career. In the 80s and 90s, it was the HIV epidemic. In the early 2000s, 9/11 changed the way that we thought about emergency care and mass casualty and things like that. Less of an emergency and more of a policy change, but the Affordable Care Act defined how an entire generation of doctors thought about value-based care and the way that we should put care around populations instead of individuals in the late 2000s. For my generation of doctors, I think that event was undoubtedly the COVID-19 pandemic.
Yeah.
It, obviously shut down the world, but you can imagine being in New York as a trainee, as I was during the COVID-19 pandemic, sort of the epicenter of the epicenter. At one time, after the pandemic hit China and then it hit Italy, the next place it really came for was New York City. And where I was working at the time, Elmhurst Hospital, deep in Queens, heavy immigrant population, very tight quarters, lots of immigrants and delivery drivers and folks of modest means staying in small apartments where this pandemic was just kind of raging through. We got the brunt of it. And
Wow.
it really shaped a lot of how I think of medicine, care delivery, and institutions can quickly change themselves to kind of meet the moment. And one of the big ways that we had to meet the moment during the COVID-19 pandemic was to really think hard about what care delivery outside the four walls of a hospital looked like.
Okay.
What do you do when 20% of the country gets an infection within a year And the capacity of the healthcare system just absolutely can't handle that amount of people. You have to get pretty creative pretty quickly about how to deliver that care outside. And I got very obsessed with this idea as a trainee. So that mostly happens in a couple of different places. A lot of that care can be moved virtually. If you're a fairly healthy person that develops this infection that was new, but we got to know it very quickly, and you're okay, and you don't necessarily need a hospital, but you need a doctor to just evaluate you. It turned out that virtual care was very good at evaluating those types of patients. And you can sort of scale that to even folks who need some hospital services. It turns out you can deliver some of those hospital services outside the home pretty effectively. So there's a program called Hospital at Home that actually you all in the UK do a pretty good job at. And in the United States got adopted fairly quickly too. I got really interested in these modalities of care. So everything that had to do with delivering acute care outside the four walls of the hospital in a way that keeps people that don't need to be in a hospital outside of the hospital, but retaining that sort of emergency medicine mindset of what are the first 3-4 things that need to happen for this patient to get the type of care they need is kind of what I made my intellectual pursuit for those years, and it continued to be my pursuit. That led me kind of pretty directly to Counsel Health, which is founded by one of the most unique individuals I've ever met, 𝐬𝐻𝐫𝐫𝐢𝐻𝐾, who is a physician, he's an engineer, an AI researcher, and he spent the last few years of his career helping build a company called Notable Health, which was a health system automation platform. He learned in a really big way how amazing product and engineering and technology teams can transform healthcare enterprises. Comes from Stanford and probably is the physician who knows technology the best out of anybody I've ever met. He had this kind of amazing idea that two large megatrends were going to come together in American healthcare, and he had this idea back in 2023. One was the inexorable rise of asynchronous care. And what we mean by asynchronous care is sort of messaging-based care or care where you are not sort of live with a doctor, kind of talking either with video or on the phone or in real life, but that care is happening at some cadence asynchronously. When we talk about asynchronous care, we mostly mean chat-based or messaging care. Part of the seed of that idea was we were finding that some of the best care that we deliver as doctors is just when our friends and family sort of text us for medical advice. These are questions that live sort of in the interstitial spaces between doctor's visits, and some of them don't even rise to the level of a doctor's visit, but they're causing anxiety, and they're happening all over to doctors all over America and the world. You can ask sort of any MD, like, how many of your friends and family text you this week with a medical question, and all of them will raise their hand and say me. But the type of care you can deliver there is kind of quite amazing, like with just like a physician that cares about you, that has the right information, that can sort of go back and forth with you via text. So we found that to be really powerful. And in American health systems, through MyChart and other kind of patient portals, we're seeing that patients were messaging their doctors more and more every year. We were seeing something like a 2x rise every year from 2013 to 2022, depending on what data set you looked at. So we were seeing a huge demand for this type of care. So that was kind of like one mega trend that 𝐬𝐻𝐫𝐽 was looking at. The second was the rise of large language models. And when ChatGPT released in sort of late 2022, I think it became clear to a lot of us in healthcare that this was not a incremental change in sort of how patients were going to seek care. Like, this was a step, this was something different.
Yeah.
So we thought that there was a really powerful idea in putting those two together. And sort of the idea is, what if a patient could text an AI platform like they could text a doctor in the family, start to get some answers back, but instead of that sort of chatbot being siloed or independent from the rest of the medical system, what if it was part of the medical system? What if that AI chatbot could then pull the doctor in at the very relevant moment in the conversation, and that doctor could do what doctors do: prescribe meds, make a diagnosis, make a referral, order a lab test. So kind of combining the amazing conversation abilities that we've seen that ChatGPT and Claude and the others have brought with the sort of domain expertise and license gated tasks that only a doctor can still do, like prescribe, diagnose, etc. So that was really kind of the founding mission of Counsel Health. 𝐬𝐻𝐫𝐽 was looking for someone with sort of a bread and butter telemedicine background that shared his vision around what this could be. And I got really inspired by that early, so I jumped onto the founding team in early 2024.
It's a fascinating story. I think it's amazing to talk to someone who was actually frontline in the COVID pandemic. I had friends of mine who were in New York who were sending me videos back of, it was horrendous. And I think if you look back and actually to try and take a positive out of that, that's obviously really giving you that kind of energy to kind of throw yourself into counsel because there's a genuine use case there. Do you think in terms of, or how do you think AI as first port of care or is being adopted by people? Because there's a lot of people I speak to, I'm fortunate enough to speak to a lot of people within health tech and digital health, and there is still that nervousness and reluctance about relying on AI to provide advice, especially when it's so important, such as your health. So how do you control that messaging and that education piece to potential patients?
I think it's a great question. I think it's one that we feel like we're answering for the first time, but we actually faced this about 25 years ago with the rise of Google at the same time,
Yeah,
similar
everyone's
types of
Googling their
things.
symptoms.
Exactly. And I feel like there's like this way that we think of people entering the medical system. And it's like
Mm,
maybe pretend like it's like 1985. And this is like the way that most people did it was they had a primary care doctor. They gave them a call. They said, "Hey, Dr. Jones, I'm feeling sick today. What should I do?" Dr. Jones says, "Hey, come to clinic tomorrow. I'll take a look at you, and we'll decide what you need." Um, Fast forward to 2025, almost nobody gets care this way. This is you
no.
have to be extraordinarily privileged to be able to have that type of relationship with a physician that can get you in that quickly to see you to actually bring you to the point you need. So we've seen this huge proliferation of almost stand-ins to this sort of service. The urgent care industry has popped up in the interim here. Technology tools like symptom checkers have come out, which have sort of middling results. Nurse triage lines were kind of invented and popularized in the late 80s and the 90s, which are good for some sort of scoped use cases, but are not a replacement for that real core feeling of someone being able to fully solve your problem. When Google came onto the scene in the late 90s and early 2000s, I think as a medical system, we did not handle it as well as we could. If you
Mm,
go into sort of hospital corridors nowadays and you talk to old time doctors or newer doctors about Dr. Google and patients kind of using Dr. Google, I think what you'd get is a lot of eye rolls because doctors are a little frustrated with Dr. Google and what it tells patients to do and how it scares people. And I don't think we accepted as much as we should as a medical sort of industry, as the house of medicine, that the level of democratization of information between doctor and patient, we're going to go from here to something like here because patients all of a sudden we're going to have access to the same amount of information we were. And obviously we went to medical school and we know how to interpret that information in a very different way. But I think it's taken us decades to fully reckon with this change. So when ChatGPT came onto the scene in 2022, it only accelerated this exact sort of phenomenon, which is that patients all of a sudden have this otherworldly alien intelligence that they can go to. They can type their symptoms in, they can ask questions. And all of a sudden, they're going to start getting answers, not just like a search page with web results and sort of links to Mayo Clinic. Not that, like real answers are going to start coming to them. And at the beginning, those answers may need some improvement, but over time, those answers are going to get better and better and better and better. So we had to figure out, right now, the reckoning that we're going through as an industry is how do we deal with this?
mm.
From our point of view at Counsel, we know we're not going to turn back the clock. We're never going to go back to 1975 or 1985. So we think our job is not to prevent people from going to places like ChatGPT. By the way, the numbers are kind of different no matter what you did, but The Economist put out a really interesting recent kind of graph that shows the decline in Google search on around various kind of topics, like whether it be education or finance, etc. And the sort of implication is the drop is caused by ChatGPT. Like, where are people going to ChatGPT instead of Google?
Yeah.
By far, the sort of topic that has seen the sharpest decline in Google searches, and therefore sort of what's implied is the sharpest rise in ChatGPT is health. ChatGPT
Interesting.
is eating the world with healthcare queries. People are doing this; they're voting with their feet. Like this is happening whether we like it or not. Like the doctors of the world don't have a say in this anymore. Patients are going to large language models for healthcare advice, period. It's just what's happening. So in our view, we can do two things. Like, we can do what we did 20 years ago, which is scold people and say, that's not what you're supposed to do. Like, you're supposed to call your doctor for all your information. You're not supposed to go to any other source. Or we can build our own clinical grade AI that is sort of approved by, supervised by, and designed by doctors, and
Yeah.
have doctors in the loop. So when that question, when that nervousness, when that anxiety, when that medical problem inevitably needs to be treated by a physician, that physician is present and in the chat and able to take care of that patient right there instead of sending them somewhere else.
Yeah, super smart. And you're right. I think I read on recently, there's obviously ChatGPT, obviously, when that came on the market, and then there was that kind of huge pendulum swing of Google's searches going down. But it's interesting you touch on how much of this was about the kind of the health part as well. Do you feel that is because post COVID, we've kind of probably in this more any symptoms or anything where we're not feeling quite right, it's just easier to type as opposed to calling your GP? Or in the UK here, we obviously have a fantastic kind of a national health service which is free, but I know in the US specifically, it's a really broken health system, isn't it? As you rightly alluded to earlier, quite privileged to be able to have a physician or someone on the end of your phone to get access to them straight away. Do you find it's because we've got this healthcare capacity issue at the moment where it is still quite privileged to access that care, so everyone's naturally going to AI or naturally going to a search? Do you feel that's the kind of why this has happened?
I think it's a big piece. Yeah. I think there's really good literature on this around the sort of supply-demand mismatch and crisis in American healthcare specifically. Wait times for primary care appointments in much of the country surpass 3 or even 4 weeks.
Wow.
And it's you can't blame the doctors entirely there. Like, their schedules are full. They're seeing 20, 30 patients a day, and it's difficult to sort of build the systems to triage every little complaint. So it's a mixture of that. And I think just the sheer accessibility of these types of platforms, that questions that you wouldn't even think rise to the level of doctor's appointments are going to these types of platforms. It's almost the world of what's considered health is growing. Like, patients are a lot more curious about supplements, about their diets, about sort of how certain exercise regimens are going to affect them, and these kind of border medicine or the world of medicine. But in a lot of ways, this used to be thought of as more like wellness type questions. But they're growing further, as the longevity movement shows, like into the realm of medicine. So I think the types of questions and the number of concerns that patients have are sort of growing because they start to encompass not just, am I taking my blood pressure medicine the right way, but sort of, how should I optimize my diet to maximize my long-term longevity? Like, that's a question that we're getting that we haven't seen as much in the past few years. And what kind of compounds that crisis, like, so we're seeing more demand as the supply is just not keeping up for regulatory reasons, for other reasons. We just are not able to produce the number of doctors that we need, or the number of slots that we need to see these concerns. And then demographically in the United States, the other thing that we're seeing is that the population is aging and becoming more complex. So the average hospitalist is now will tell you that the patients that they're taking care of on a day-to-day basis are just more complex. There are more medical problems. They're on more medications. They're older. They're frailer. They take more time and energy per patient to care for. We have less doctors than ever to sort of care for them, and they have more questions than they did before. So I think all of this together is sort of a perfect storm for something like an answer machine, like a large language model, to start providing a whole lot of value to folks.
Yeah, and I think that's a really valid point. There's a huge, people listening in here, there's a huge demand for more qualified doctors and physicians in the US. There's obviously a huge issue with staffing, and that's obviously compounded on your point. You've got an aging population, you've got this accessibility to AI, and it also ties into you touched on something really valid there about AI is great, but you've got to train those models, haven't you? You've really got to train it to ensure that the information it's providing is as factual and as relevant as possible, because sending a query with all your deepest, darkest kind of medical history, for me, I wouldn't feel comfortable with. So you've compared kind of training AI to training medical students, and I'm interested to touch on that. How does that ultimately shape the way that you're building Counsel? Because obviously we can all go into ChatGPT now and send a picture, and I've, people practicing on this, but for me, I think, I don't know how I feel about releasing that information into the wild. So talk to me about that kind of comparison about training AI in medical students, and how does that kind of shape what you're building?
Yeah, no, it's a great question, and it's one that we talk about internally kind of a lot at Counsel. It's helpful because this technology is so novel and can feel so alien at times, and when you get deep into the real technicalities of how it works, like it's is totally new, and sometimes it's useful to put things in a frame that we already understand. So how we think about this at Counsel is that we are supervising AI delivering care. Um, and we actually do have a really useful framework in medicine for how to supervise a novice delivering care. We actually do it all the time. We have first-year medical students start to talk to patients, and they come back and they talk to their superiors, and their superiors say, "You did this right, you did this wrong. I'm ultimately in charge. Good job at this. Fix this next time. But this is the plan of care, and I'm the one who's driving that plan of care." And we found that framework to be really useful with our clinical AI at Counsel, and to think of it less as in other industries they're calling these co-pilots or sort of other things, but we sort of really like the frame of medical education. Because medical educators are some of the best people in the world. They're endlessly patient, and they're the ones that really drive the next generation forward. But if we start to think of AI as less of a sort of overseer or co-pilot and more of a medical student that is working and learning and getting better, it helps us kind of train it,
I like that
So
analogy.
there are like rubrics for how to grade how well a medical student takes a history. There's a notion in medical education called graduated responsibility, meaning at first you get this much leash, and as you get better and more experienced and sort of meet certain milestones, you get more and more leash, and you get more and more freedom to actually have longer conversations with patients, to start to suggest more advanced plans and things like that. So we found this to be a really useful kind of device kind of to use with our models, especially as the models, like the frontier labs, are making better and better models every day. But rather than sort of be bowled over by the advancement every second, it's easy for us to say, okay, how many milestones does this new model hit? And for that reason, how much sort of freedom should we give it, and have it always be supervised by a doctor? So it's just been a useful kind of rhetorical framework for us as we think about advancing our models.
Yeah, it's smart. And I like the fact you tied it into real world. So obviously, as you said, you're kind of first year med students, and actually because you're, as I said at the top of the intro, it's very unique. You've come from industry. You're an emergency doctor yourself. You've been at the front line of some of the hardest. COVID's probably one of, if not the most devastating thing that's ever happened. But actually, you're at the front line of that, and I think it's interesting that you've tied that all into your experiences, because ultimately, I'm guessing that just enables you to deliver a better product and, for all of people here, to deliver better care. I suppose that's the objective, right?
I hope so. It's important to us at Counsel to be physician-led and to sort of lead with physicians. This is amazing technology, and it's I don't think anybody who works with these models closely does not think they're going to change the world. It's just inevitable that these things are going to change the world. But in medicine, we have to be a bit careful than in other parts of the industry or other industries in general, because we touch lives. There's safety concerns. There's obviously privacy concerns. So we find it useful to use kind of tried and true frameworks that have applied in other areas of medicine, and then to bring it to this new place, and ultimately, have AI be supervised by physicians, and sort of built by physicians and designed by physicians. That's part of kind of the core thesis of Counsel, is that that's how eventually AI-led care should be brought into the world, is sort of with the help of physicians.
100%. Yeah, I feel if you force feed this to people, then ultimately you're going to alienate more people than you're going to engage, which I think's super important. And I'm really interested to kind of close off with your journey, because as I mentioned, you're not your quintessential tech founder. You've come from industry. You're very passionate. It's a space you said you've always looked at. I thought this is really fascinating. And actually, just over a year in now, talked about that journey in terms of some of the lessons and maybe some of the some of the surprises that you've come across when building this? Because I'm guessing for you, you came in with your eyes wide open, but it doesn't necessarily mean everything. So talk to me about that kind of the last year. What's been the kind of the major things you've taken away from that year?
It's been a ride. It's been quite amazing. I think the space that we're in has garnered so much interest over the past year because it's one of these things where you really intuitively grasp that we need a better solve here, in terms of patients not having a really amazing first place to go to ask their questions to, the supply crisis, the sort of inability to schedule an appointment with any sort of physician who can take care of you in a reasonable time frame. Like the crisis piece of this is very well established. What I've taken away from it over the past year has really been, how does an amazing sort of multidisciplinary team go after this problem? In my past life, I've worked with amazing researchers and amazing doctors and amazing sort of organizational thinkers. I'd never really worked with really amazing technologists. And having the AI talent, the product talent, and the engineering talent to really go after this, has changed the way I think of how fast you can move. It still surprises me when I ask for a feature or when I think something can be improved, and I sort of bring that to our engineering team, and 24 hours later there's a fix and we have a new direction. Like, I am just not used to that. I think sort of physicians that come from health systems and insurance companies and sort of the more traditional healthcare enterprises, just like, it is not normal for us to be able to move this quickly. And I think that's something that sort of the house of medicine can learn from technology, is like, when something is a problem, to treat it as an urgent problem and to go solve it quickly. I also find that my engineers and in my product team think in a very specific first principles way that I think is a lot more common in Silicon Valley, that forces me to re-examine my own assumptions. Medicine is amazing at sort of creating these types of professionals out of kind of medical students, out of people that have no exposure. And then you come out several years later and you sort of like you can spit back the lessons that you've been taught over the past few years. I think it also makes us a little bit dogmatic at times, and makes us accept the world sort of as it is and the structures that we're in as it is. Like, why is it that we can't get an appointment for a patient for 3 weeks out? Like, what are the operational structures that are limiting us? Like, if we really dive down, I think engineers and product people, the way that they're taught, their discipline is to approach problems from a first principles mindset. And, it's been a while since somebody asked me, like, why not, so many times for like a basic assumption that I hold. And I think if we're building sort of one thing at Counsel that's really unique, I think it's a mixture of clinical AI and technical talent that I think is not matched sort of otherwise. Our team is very close. We're a small team. We're tight knit, but sort of having those different disciplines all under one roof and talking to each other and elbow to elbow with each other it's probably been one of the more transformative professional experiences I've ever had.
Yeah, no, look, I think the journey's fascinating. I love the product, and I've obviously been on the website and played around with it. And people listening here, you can go on to Counsel Health site, actually see it, look at the use cases. But I think it's solving a genuine problem. And I think even though I do talk here in the UK, it's still very hard to kind of get immediate answers to questions. So I generally see what you're doing. Obviously, you and the founder team know what you're doing. So yeah, thanks so much for coming on. I'm glad we could finally make this happen because it's been really insightful, and you've got such a unique background. I think for anyone listening here, check Rishi out. Really fascinating background, and equally what Counsel are doing are, doing something generally that's needed. So thanks again for coming on this morning.
It's been a pleasure. Thanks for having me, Alex.
Cheers, Rishi.
Thanks.